Good evening and welcome to NextGen 8.3 SOAP training for physicians. You'll notice that I already have a patient open up on the computer by the name of Ava Test. You're welcome to utilize any test patient or any regular patient in the system so long as you're in the test mode. At no point in time will we ever copy over anything from the test to our production database. You'll notice that the look and feel is similar, although there has been some added functionality. The first thing I'd want to draw your attention to is from the PIS bar, the Patient Information Bar. I do have the ability to expand and collapse, and you'll notice that I have the ability to access my telephone call template by selecting this new telephone call template navigation. I can send a to-do task on this individual patient, and of course I can also track this patient. By tracking, we're referring to putting them in a room or maybe marking them for checkout. You still have the ability to look at the patient information as their contact information. You have the ability to look at their dress, their date of birth. Obviously, you have the ability to look at their weight and their last vital signs by hovering over. You also have the ability to look at their allergies, their problems, any diagnosis history, medications. You'll note that it references the PCP of record and the pharmacy defaults for 1 and 2. You also have the ability to review any alerts. You can review the OB-GYN details. You have access to patient demographics, to a sticky note, and of course your documentation on templates with regards to HIPAA, advanced directives, and the screening summary. On the SOAP template itself, you still have the ability to look at the intake screen, the history screen. You'll notice in our current version, we have the ability to access the summary. The summary has now been moved to the home template, as represented by icon of a house. You have your finalized office visit and your checkout. You'll also note the absence of the care guidelines. Care guidelines have now been added to each individual page. At this point in time, care guidelines are not functional. However, after we make the conversion, we'll be working on setting up the care guidelines. You'll also notice that you have these new sub-navigation templates to move around to other templates quickly without having to utilize your preferred templates. You can still use your preferred templates should you choose to utilize them, but you'll also notice that from every page you have a different sub-navigation templates. You'll also notice the addition of panel control. These are for physicians perhaps who don't enjoy scrolling. Each panel you'll notice is general, your reason for visit, your review of systems, your vital signs, your physical exam, and your assessments. If you choose, you can collapse all those panels just by hovering over them. This will collapse your panels. And this is what it looks like with your collapsed panels. And then expand will expand and open all your panels. While you're in the collapse mode, you do have the ability to use your cycle up and cycle down, and literally what that will do as I use the cycle key, it'll open up the next panel and close the current panel that I was working on. And as you continue using the cycle up or cycle down, depending on which direction you'd like to move, the current panel closes and the next panel opens. I prefer to have mine open and expanded, so I'm going to go ahead and expand it all. You do have the ability to set whether you have it in a collapse mode and the order for your panels. That's set up on an individual user. Whatever you select will hold and maintain as you open from patient to patient. I'm going to go ahead and by right-clicking my mouse, I'm going to go ahead and set it back to panel defaults as set by NextGen. The first thing you'll notice that established patient was selected by the medical assistants. The first time the patient's seen in NextGen, it'll always default to new patient. Subsequent visits will always default to established patient. You'll notice that the reason for visit has already been captured and documented. The reason for visit You have the ability to enter up to 6 reasons for visits in the detailed history. You'll notice I've selected hyperlipidemia, diabetes, and allergies. You also have the ability to open up the additional manage to make a selection for any other reason for visit. And you'll notice that we've populated the top 14 diagnosis codes in the same exact order we have in our current version, as represented by diagnosis codes that have used by physicians in the past. You'll also notice that the intake comments are still available for review. You'll also notice that you have the ability to review your diagnostic history. The user can add as many of the tests as necessary and should provide only the level of detail that's relevant to the specialty. So if I select the diagnostics, while the diagnostics template has changed somewhat, it has the same functionality. So if I'm going to document that this patient had a mammogram, I'm going to select mammogram. I can still select HEDIS. In this case, I'm going to document that it was a screening. The date that the patient stated they had it was on June 30th. I can still document the performed by and the location, whether it was ordered elsewhere. If it was a scanned document, I could document it was a scanned document. If it was when I was in the room with the patient, perhaps the patient told you that they had their mammogram just recently, you can document that the patient reported having the mammogram on the individual specific date, and then once the results are received from the patient or results are received from the imaging facility, we can always go back in there and change it. But for now, I'm going to add it to the grid. But I do want to add in that there's this new feature that if I select this add to HPI before selecting the add to grid, then it will make a documentation on the HPI of the information that you captured. If at some point in time in the future the patient tells me I actually receive a copy of the results, then I can always go back into the diagnostics, highlight the individual diagnostic in question. I can change it from patient reported to negative, and then I have a scanned document. Your staff can do this, and then they would just update that information and then save and close. You do have a new template that's called Chronic Conditions Template. The purpose of the Chronic Conditions Template is charting on a patient's chronic conditions during the visit, where it's provided a button, and you'll see the button right here. On the intake and on the SOAP template, it's right underneath the reason for visit. And the Chronic template is used to document the status, compliance, and any other issues with regards to that chronic condition. So it provides you ability to document multiple conditions at one time on one template without having to go to and open up each individual HPI. So I'm going to select the Chronic Conditions template. You will know that the Chronic Conditions template is a little bit slow. That's to be expected in the test environment. I do expect that as we move to the production environment, it'll be a little bit faster, so I do apologize. You'll notice on the left-hand side of the screen, you have the different diagnosis codes that are documented as being chronic in nature for this patient. So I'm going to select the hypertension because the hypertension is the first one I'm going to address. You'll notice when I selected hypertension, it automatically populated, and it linked it to the ICD-9 code of 401.9. I have the ability to mark this as a chronic condition if it wasn't already marked as a chronic condition, or I can mark it as a track condition. Track conditions are traditionally something that maybe perhaps are not of long-term nature, or maybe something that you expect in the future will resolve, maybe perhaps a fracture of some sort. I can select the on date. I also have the ability to come in here and document any plan notes or any patient details, as well as access the common phrases or my phrases. I have the ability to select lab review, so if there's a specific lab that I would like to review with a patient while I'm in the room with them, maybe perhaps their hemoglobin A1C, and we document that that's normal. I could also put the results if I wanted to. If I wanted to document the LDL and document, in this case I'm going to select the LDL, and then I'm going to go ahead and add it. So you'll note that there's a notation here, and maybe perhaps I'm just going to put an LDL of 79, and then maybe I might also want to discuss with them their total cholesterol and document their total cholesterol after I've added it is being 175. Then I can go ahead and save and close that. And you notice that information will become available as part of the notes for the visit today. You also have these screening questions that I think many of the physicians will find a benefit. You select screening questions. There are specific questions that routinely physicians ask them with regards to the condition that may at this point in time not be documented just because it takes too long to document them in the system. It isn't that they haven't been asked, it's just we haven't documented them. So in this case, I'm going to document the patient has been checking their blood pressure at home and that they've been following an exercise program. The patient indicates they are on a low sodium diet, but they haven't lost any weight. Maybe perhaps they're not drinking any alcohol, so I'm going to document that alcohol status is NA. Maybe perhaps they're not smoking, so I'm just going to basically document there that it's. And then I can document if there's any new symptoms in the last visit, as well as are there any problems with their current medications. And I'm going to say no. And then I'm going to go ahead and save them. Before I document those, I did want to let you know that I failed to document the assessment status, and that's one of those questions didn't answer appropriately. So I'm going to go back into the screening questions again, and I'm going to document the appropriate answers. Then I'm going to go ahead and save them, and then I'll close them. You'll also note that I have the ability now to go over and select a different one. So in this case, I'm going to select diabetes. And diabetes will populate. And then of course I do have the ability then to go into the lab review for the diabetes, as well as selecting any screening questions. I just want to move to the screening questions because I feel like they're pertinent questions that perhaps that you might normally ask a patient that you would like to have documented. There aren't any specific questions for the hyperlipidemia, but understand we do have the ability to build out these screening questions. I'm going to document the diabetes as being fair controlled. And I'm going to document they've been taking their blood sugars at home and they've been checking their feet and they've been following a prescribed diet and that they're exercising. They haven't lost any weight. There's no problems with their current medications, with no new symptoms, and that they're not using any tobacco products. And then I'll go ahead and save it and then close it. And all the information that you're documenting, the question and the answer to the question, will generate on your Master IM. Remember, you have the ability to highlight any one of those and document the comments. And I'm going to go ahead and save and close so we can go back in to complete the SOAP documentation. You'll notice that the next panel is a review of systems. You should have the ability to select any review of systems that you have saved. You'll notice that some of the information has already been populated. I'm just going to select something that one of the physicians have available to review. The information should automatically populate. Please let us know if perhaps maybe your defaults didn't transfer during the copy. And I'm going to go ahead and save it and close that. You'll also note that those chronic conditions that I addressed has a little notation saying the chronic conditions were addressed. You have your vital signs. Now, I've already entered in some vital signs, but I'm going to go ahead and open up and look at it again. You'll notice that the information that I already highlighted has been filled out. If I wanted, though, however, to check another vital sign while I was there, it would. So I'm just going to add in a new vital sign for the blood pressure because the blood pressure was out of range. And this time, whenever I checked it, I'm going to document it as being 134/76. And you'll notice that the last blood pressure taken is the one that's listed as most recent. You also have the ability to go into this health promotion plan. The health promotion plan, it gives you the area to document your HPI. Now, you can still get to your HPI template from your vital signs template, and I'm going to go ahead and open this one back up. And the BMI plan is here. You have the ability to select, in this case, the patient's BMI is 27.88. So I can select the appropriate diagnosis code or V code. You can defer this to your staff as well. Select something from the pick list in either the diet or physical activity, and this is primarily for documenting your ACO templates. And then I'll go ahead and add it. As I select add, you notice that it highlighted and documented in the orders today. And then I'm going to go ahead and save out the adults. You'll also notice that you have this health promotion plan. This is new. The health promotion plan, you'll notice the BMI plan. You have the ability also, though, to select a depression plan or hypertension plan. On the same template, you have the ability to document a pain management plan as well as a fall risk plan. This information is also available on the social template right here, and the histories. Under the physical exam, you still have the one-page physical exam, and one of the big changes on the one-page physical exam would be the addition of the diabetic foot exam template. You'll notice that that's listed right up here at the top. You no longer have to go into the vascular to check the pedipulses or to the extremities to do the monofilament. As you open up the diabetic foot exam, that information will become available. And of course, they've allowed for the visual inspection and the nails, any ulceration documentation, measurement of footwear or evaluation for counseling, and then of course the monofilament exam itself. And I'm going to document that was abnormal. And then I'm going to go ahead and save it and close it. Beyond the change on the diabetic foot exam, there weren't too many changes on your sub-template. So I'm going to go ahead and save and close. And I'm going to select a template default just so I have something in here to print. And you'll notice the information populates as it has in previous versions. The next thing you'll notice is your assessment and your plan information. This information will be covered in a separate training session, but you will notice that the assessment and plan information is already starting to populate. You still have the ability to access your medication modules, to access your procedures, to generate a patient plan, to automatically send to the patient portal, provided that patient portal is open to that patient, generate a patient plan on the fly, generate a note, and of course the access to your E&M coding. You also have the ability to access your pediatric immunizations and your adult immunizations. You have your ability to access your custom lab letter and the provider test actions, your procedures, your orders management, and your document library. In this case right here, I'm just going to quickly open up the custom lab letter. You'll notice on the custom lab letter, there were no changes on the custom lab letter. You still have the ability to do your introduction and of course pull over and import any labs from recent labs. And you still have the ability to look at the medications or any vital signs, or look at any allergies that have been documented, as well as put in your greetings, your salutations, any specific comments that you might have in your My Phrases, and then you're generating that document or sending that document to your staff for disposition. You also have the provider test action, and while there were a few changes on the provider test action, for the most part the functionality is still the same. You have the ability to look at your appointment information. Notice that you do have panel control on each one of your templates, the contact information, of course viewing any orders, your diagnostic studies, maybe perhaps any lab results that might be in the system for that patient, as well as any specific referrals or anything that's been ordered in previous visits. You have the action log. You still have the ability to type any comments, and you still have your to-do items, as well as accessing the My Phrases and managing your phrases. You can generate your lab document by hovering over the top of this and selecting the last 30 days or maybe perhaps all docs. You can select to repeat the to-do items. In this case, I'm going to document to repeat the test within 6 months, and maybe perhaps I'm going to document to send the actual test results. And then I have access to my plan and of course to the custom lab letter, as well as viewing the diagnostics. And I can save and complete it, or I can go ahead and save and task it if I want to task that to my nursing staff. In this case, I'm going to go ahead and save it and task it to the nursing staff member. And then you'll notice that the document automatically generates as you select the save and complete or the save and task. And the document is similar to what you've used in the past. Going back to the SOAP note, you still have the ability to access any procedures. You can still view orders management, and of course you can access the document library for generating some of your quick and easy documents, as well as accessing the health status assessments. You'll notice through looking at your histories that the patient history has not changed. You're still able to look at the patient encounter history in the same order. Your patient demographics is still available, and of course you have access to your patient demographics from your patient demographics tab or from the patient information bar, and then of course your categories, which are of course a compilation of any kind of documents that have been scanned, any documents generated, any templates that have been accessed. Review your history. You still have the ability to look at any preferred templates that you have set up. You have the ability to look at your procedures, which shows the patient's procedure history as well as the diagnosis codes associated with that procedure. You still have the ability to look at your allergy module and of course your medication module, and there were no changes on the allergy module or the medication module. And of course you have the ability to review your orders. In the order section, you'll notice while you have your labs that are ordered, you also have the ability to look at your immunizations. Immunizations are now going to be administered and ordered out of the orders module. There's your lab results document that was generated. And it's generated the ones that were in the last 30 days. And then of course your provider test action. That completes SOAP training for NextGen 8.3.